I want to tell you about two men, same age, same diagnosis, same surgery scheduled for the same morning. The first one walked into the operating room like he was walking into his own kitchen, joking with the nurse about her coffee order, hopping up onto the table without anyone touching him. The second man needed both of us just to help him sit. Two people lifting one man onto a table. I've never forgotten that morning. And in over 20 years of practicing medicine, I've watched that exact scene repeat itself so many times that I stopped believing it was random a long time ago. Something in these two men's bodies had aged in completely different directions, even though the calendar said they were the same age. And I think, if you're honest with yourself, you already suspect the same thing about your own body. You know people in your life who are 70 and moving like they're 50. And you probably know people who are 50 and moving like they're 80. The number was never really the point. I think about that morning almost every time I sit down with a new patient now, because the conversation we usually have first, before we ever talk about the surgery itself, isn't about their diagnosis. It's about their life. Do they still garden? Do they still climb the stairs to their own bedroom without stopping halfway up? Do they get down on the floor to play with a grandchild? And more importantly, do they get back up without anyone's help? Those questions tell me more about how someone will do after surgery than half the tests we run. And I've come to believe they tell you more about your own future than most of what gets discussed in a routine checkup. I'm Dr. William Lee. Before I take anyone into surgery, I look at something we call physiological reserve. It's a simple idea, really. How much gas is actually left in the tank? Not what your chart says, not what your birthday says, but what your heart, your lungs, your muscles, and your balance can actually do when they're asked to. Because surgery asks a lot of a body. So does a bad flu. So does tripping on a curb at 78. The people who come through those moments and bounce back, and the people who don't, usually looked identical on paper beforehand. The difference was hiding somewhere else. So today I want to hand you something I don't think enough doctors take the time to explain clearly. A handful of things you can actually check yourself at home this week that tell you more about how you're really aging than most of what gets measured in a 15-minute checkup. And I want to walk you through why each one matters, and more importantly, what you can actually do about it if you don't love what you find. Because here's the thing I really want you to hear underneath all of this. None of these are a life sentence. Every single one can change. Let's start with something so ordinary you've probably never thought of it as a medical measurement at all. How fast you walk. Researchers actually call this a vital sign now, right alongside your blood pressure and your pulse. And when you think about what walking actually requires of your body, that starts to make a lot of sense. Your heart has to pump, your lungs have to keep up, your muscles have to fire in the right order, your joints have to move freely, your inner ear and your eyes have to keep you upright, and your brain has to conduct all of that like an orchestra, dozens of times a second, without you ever thinking about it. That's an enormous amount of coordinated work happening every time you cross a parking lot. So when your pace starts to slow down, even a little, even in a way that feels like nothing, it's often the very first sign that something in that whole system is starting to strain. Long before any blood test would catch it, long before you'd ever think to mention it to your doctor. Studies that have followed thousands of older adults for years, sometimes decades, keep finding the same thing. People who walk faster tend to live longer. Not by a small margin either. And this holds up even after accounting for other health problems people might have. Somewhere around 3 feet per second, which is really just a normal, purposeful walking pace, tends to be the line where things look meaningfully better. Slower than that, and the risks start climbing. Here's what I want you to actually feel good about, though. This is fixable, and it doesn't take much. Just walking regularly, especially if you throw in short bursts where you push your pace a little harder for a minute or two, then ease back off, can genuinely speed you back up over time. I've watched patients shave real time off their walking pace in a matter of weeks, doing nothing more complicated than that. I think of a woman I've been seeing for years. I'll call her Ruth, 74 years old, who came in one winter telling me she'd started noticing She was always the last one to reach the car in the parking lot with her daughter and grandkids. Nothing hurt, nothing felt wrong. She just felt like she was trailing behind everyone lately. We measured her pace over a short distance, and sure enough, it had slipped well below where it should have been for someone her age and health. We didn't do anything dramatic, just 3 walks a week, with a few minutes of pushing herself a bit harder mixed in. 8 weeks later, she told me, almost laughing, that she'd beaten her granddaughter to the car. That's the whole point. It's rarely about becoming an athlete, it's about not being the one trailing behind. Now, here's one that always gets a reaction from people: grip strength. It sounds almost silly, right? How hard you can squeeze something. But stay with me, because your grip strength is quietly one of the best windows we have into your overall muscle strength and into what I mentioned earlier, your physiological reserve. The reserves your body has stashed away for when things get hard. It turns out your hand strength tracks remarkably closely with the strength of much bigger muscles all over your body. And the research on this is honestly a little sobering. Weaker grip strength shows up again and again alongside higher risk of falling, slower recovery from illness or surgery, and yes, shorter lifespans. It's one of the cheapest tests in all of medicine, and it tells us an almost unreasonable amount. But again, and I really want this to land, grip strength responds beautifully to just using your muscles, carrying your own groceries instead of asking someone else to, a resistance band you keep by the couch, basic strength work twice a week. I've seen this work in people in their 90s. Truly, it is never, ever too late to start. I remember a man, a retired mechanic in his 80s, who came in convinced his hands were simply done. Arthritis, age, whatever you want to call it. He couldn't open a jar of pickles anymore, and it genuinely bothered him more than any of his other health concerns combined, which surprised me at first. But when we tested his grip strength, it wasn't arthritis holding him back nearly as much as simple disuse. He quietly stopped doing the things that used to keep his hands and forearms strong. We started him on nothing fancy, just a soft resistance ball to squeeze while he watched television in the evenings. Within 2 months, he opened that jar of pickles himself, and he brought me the lid to prove it. I still think about that lid. Third, and this one is a personal favorite of mine to explain, cardiopulmonary fitness, which is really just a fancy way of saying, how well do your heart and lungs get oxygen to your muscles when you're actually working? Doctors measure this as VO2 max. And if you happen to wear an Apple Watch, you've probably already seen this number without realizing how much it actually means. Across an enormous amount of research, this single number keeps showing up as one of the strongest predictors we have of how long someone will live. In some studies, it beats out smoking. It beats out diabetes. Think about that for a second. Your fitness level may be telling us more about your future than whether you smoke cigarettes for years. Why would that be true? Because a body that moves oxygen efficiently simply has more to give when life asks something hard of it. Illness, surgery, a bad infection, or honestly, just the ordinary demands of staying an active, engaged person in the world. And the beautiful part, this is trainable at almost any age. Brisk walking, swimming, a bike ride, anything that gets your heart working a bit harder, done consistently, moves this number. I generally point people toward about 150 minutes a week of something that raises your heart rate, spread out over most days. It doesn't need to be dramatic. It needs to be consistent. Now let's talk about the thing almost everyone quietly worries about as they get older: falling, which really comes down to balance. Balance isn't one thing. It's your inner ear, your eyes, the feeling in the bottoms of your feet, and your muscle strength, all talking to your brain at the same time, constantly, without you noticing any of it. And as we age, any one of those pieces can start to slip, quietly, with no real warning. Balance is very often the first place we actually notice something has changed. And here's what I need you to really sit with. A fall isn't just a bruise or a scare. A serious fall in your 70s or 80s is one of the single biggest reasons people lose their independence for good. A broken hip, a hospital stay, and sometimes, sadly, never quite getting back to how things were before. That's the real stake here. Which is exactly why balance work matters so much more than its small time commitment would suggest. Standing on one leg. Tai Chi, which actually has real research behind it specifically for preventing falls. Simple stability exercises. If you want a way to track this yourself, just time how long you can stand on one leg with your eyes open, near a counter for safety at first, and check it again in a month. That one number will tell you a lot. I think of a patient's husband, not even my patient at first, just a man who came along to an appointment and sat quietly in the corner while his wife and I talked. When I mentioned balance and falls, he got very still. It turned out his own father had broken a hip at 79, reaching for a cereal box on a high shelf, and had never really walked the same way again afterward. Spent his last years far more limited than he ever should have needed to be. That story stayed with this man for decades, quietly in the back of his mind. He started practicing single leg stands that same week, right there in his kitchen while the coffee brewed. Small thing, but I think about how differently his father's last years might have gone with just that much. And now the last one, and honestly, I think it might be the most telling of all. Can you get up off the floor without using your hands or your arms at all? There's an actual validated test for this. Researchers call it the sitting rising test, and I love it because of how much it demands all at once: leg strength, core strength, balance, flexibility, and coordination, all firing together in a single movement. It's a full body checkup disguised as something you do without thinking twice about at 25. And the research following people who take this test is genuinely striking. People who couldn't do it without using their hands had a meaningfully higher risk of dying in the years that followed compared to people who could rise easily. This has nothing to do with being athletic. It has everything to do with whether your body still holds on to the basic combination of strength and coordination that real independence quietly depends on. If you try this today and you can't do it, please don't let that shake you. I mean that. This is one of the most reversible things we've talked about. Practicing the pieces, a simple squat, kneeling down and standing back up, rising from a lower and lower seat over time, rebuilds exactly what this movement needs. I've watched people go from needing both hands and a chair to standing up off the floor clean in a matter of months. I have one story about this that I think about often. A woman, 79, came to see me after a minor fall in her own hallway. Nothing broken, just badly shaken. When I asked her to try rising from the floor as part of the exam, she genuinely couldn't, not even close, and she started to cry right there in my office. She told me she hadn't realized how far things had slipped until that exact moment, kneeling on my exam room floor, unable to stand back up on her own. We built a plan together, starting with something as small as practicing getting up from a slightly raised cushion, then lowering it week by week. 4 months later, she sent me a video of herself doing it from the floor. No hands, no hesitation. She said watching that fall in her hallway had scared her more than any diagnosis ever had, and that this, of everything we'd worked on, was what finally made her feel like herself again. So here's what I really want you to walk away with today, more than any single number or study. How long you live, and maybe more importantly, how well you live, was never really about a value on a lab report. It's about whether your body still has the strength, the speed, the balance, and the coordination to keep doing the things that make your life actually feel like yours. Walking your dog, getting down on the floor with a grandchild and getting back up without thinking about it, recovering fully after you catch a bad cold instead of it knocking you down for good. And here's the part I hope you actually carry with you after this video ends. Every single one of these 5 things: how fast you walk, how hard you can grip, how well your heart and lungs perform, your balance, and whether you can get up off the floor on your own, every one of them can genuinely get better. At 60, at 70, at 85, I've seen it happen more times than I can count, and the research backs up every word of what I've told you today. I'm Dr. William Lee, and honestly, this is the whole reason I do this. I want you healthy, capable, and standing on your own 2 feet, doing the things you love for as long as humanly possible. If this gave you something worth thinking about, do me a favor and subscribe so you don't miss what's coming next. And I'd really love to hear from you. Tell me in the comments which of these you're already doing well and which one you're going to start working on this week. If someone in your life comes to mind while you're reading this, someone who needs to hear it too, send it to them. Until next time, stay strong, stay capable, stay healthy. I'll see you in the next one.